Good afternoon, everyone. How are you all? Welcome to our fourth regional webinar for the Safeguarding Hub of Eastern Europe. My name is Sarah Martin, and I'm the Regional Capacity Building Advisor for the Safeguarding Resource and Support Hub Eastern Europe. We're going to be talking about our safeguarding report today, and you can access a copy of this report that's being discussed on our website. You can also get more information about our panelists, their bios, and the organizations that they represent on our website as well. So here's our agenda. As you can see, we have a couple of ground housekeeping that we'll take care of, and we'll finish with a poll. We're always very interested in getting your feedback from us about what you think of our webinars. So please stick around to answer the questions of the poll at the end. So at the Safeguarding Hub Eastern Europe, we're guided by the following values, as you'll see here on the PowerPoints. Most importantly, we strive to do no harm. That means we take the safety and security of our participants in our program very seriously. This also means for participants in our webinars. We've established a few ground rules for this webinar that include, next slide, please. No abuse or harassment will be tolerated towards our panelists or anyone else who is attending the webinar. We're not using the chat function in this webinar today, and we've screened all the participants before the webinar to mitigate any harm from persons joining who might have the intention of harassing our participants and speakers. Any offensive questions about people's gender identity or sexual orientation will not be accepted, and the participant will be removed from the webinar. We hope you appreciate our ground rules, and with that out of the way, that we can move on to the content of the webinar. So what is safeguarding? For those of you who are new to the Safeguarding Resource and Support Hub, let me give you a little brief overview and invite you to check out our website for more information. We have a number of documents and e-learning and different tools that you can use to deepen your own understanding of safeguarding. The Safeguarding Hub Eastern Europe is a resource for organizations and individuals who are responding to the war on Ukraine, and it provides practical and accessible safeguarding resources that aim to reduce harm to refugees and displaced people. Here in Eastern Europe, we've seen over the past 16 months, people across the region have mobilized to welcome and offer hospitality to the refugees and displaced people who have fled the war in Ukraine. Many organizations, both big and small, are involved in the humanitarian response. Unfortunately, as we know throughout our global humanitarian experience, that in times of crisis, there can also be those who join to cause harm, and that harm is committed by humanitarians. This harm can include sexual exploitation and abuse, discrimination, or harassment. At the Safeguarding Hub Eastern Europe, we use the term safeguarding, which means preventing harm to people in the delivery of humanitarian assistance. You may also be used to the terms PSEA, which means protection from sexual exploitation and abuse, but safeguarding is a broader term, and it also incorporates acts that are not just sexual exploitation and abuse. Okay, next slide, please. So, we are very excited today in the Pride Month, to host this webinar because we know that refugees who face multiple forms of inequalities are at greater risk of being targeted for violence, abuse, and discrimination. This includes lesbian, gay, bisexual, transgender, queer, and intersex persons. Often we put these together in the acronym LGBTQI+. And we know that LGBTQI plus persons face increased safeguarding risks and also barriers to accessing services due to structural inequalities inherent in the system and discrimination against people with diverse sexual orientation, gender identity and expression, and sex characteristics. This webinar is going to be discussing the Safeguarding Support Hub's new report that was launched today, and again, you can find it on our website, that explores safeguarding risks faced by LGBTQI plus refugees from Ukraine when they access humanitarian assistance in Eastern Europe. As there's very limited research on the safeguarding risks that LGBTQI plus refugees face, and very limited guidance globally and regionally on how to make safeguarding more inclusive for LGBTQI plus people, we're very proud to contribute these learnings from Eastern Europe to the research today. We're also very proud to have one of the authors of the report. The report is called Safeguarding LGBTQI plus Refugees in Eastern Europe, Safeguarding Risks and Needs Assessment in Poland, Romania, and Moldova. Veronica Allenbach from Social Development Direct can't join us today, but we do have Lenny Emson. Lenny is here with us today to present the findings of the report and participate in a roundtable discussion afterwards. Lenny is a Ukrainian-born LGBTQI human rights activist who identifies as bigender. He has over 20 years of experience in the fields of human rights activism and advocacy for LGBTQI freedom. He has been involved in the movement as an activist, founder, and employee of several LGBTQ nonprofit organizations in Ukraine and abroad. In 2021, he became the executive director of Kyiv Pride, the biggest pride nonprofit in Ukraine. Today, he also represents the international community on the ILGA World Steering Committee on Trans Issues, the Eurasian Key Population Health Network's Global Expert Group on Transgender People and HIV/AIDS, the Board of Transgender Europe, and the grant-making panel of the International Trans Fund. So please join me in welcoming Lenny. And Lenny, we're very excited to learn more about the report.
Thank you very much, Tara. I'm happy to be here and happy to celebrate Pride Month with this report, the very important work that we did for LGBTQI refugees, Ukrainian LGBTQI refugees fleeing to Eastern Europe. So I'm Lenny Emson, and I'm the Executive Director of Transgender Europe, the regional organization that is working for trans rights in Europe and Central Asia. And I'm Ukrainian, and I'm an expert in LGBTQI human rights issues in Ukraine, in the region, right? And this report for me was a very special work that we did in together with activists from Poland, Romania, and Moldova. So the purpose of the report was, of course, to identify safeguarding risks facing Ukrainian LGBTQI refugees in these three countries, right? And to understand the current situation with safeguarding awareness and practices among LGBTQI organizations working in refugee and humanitarian response. So our goal was to identify good practice, right, and to identify lessons learned within this process and provide recommendations for future interventions with LGBTQI refugees. Okay, next slide, please. So a little about methodology, so how actually report was built. So we picked up LGBTQI organizations in Poland, Moldova, and Romania. So 10 LGBTQI organizations provided data for this report. So, and of course, the main criteria was, say, this organization should have worked to support LGBTQI refugees from Ukraine, so have experience with this population. So, and we identified this organizations through researchers, networks, right, and of course through our contacts within the community, right, and it was very important to make sure that these organizations represent the diversity of LGBTQI community members, so not just LGBT part of the community, but as well to transgender people. So, of course, there were some limitations, right? So, for example, we had a lack of reported data on safeguarding incidents against LGBTQI refugees in all countries of the study. This happens due to stigma, fear, and lack of reporting mechanisms. So unfortunately, this was a big limitation here. So this limitation, the next one, very limited literature on the topic. So unfortunately, the number of surveys and literature around the LGBTQI topic in Eastern Europe is really limited, and this probably would be one of the recommendations for the future researchers, is to provide more data on LGBTQI in Eastern Europe, specifically in Ukraine and other countries in the region. So this report builds on LGBTQI organizations' observations and reflections of safeguarding risks that LGBTQI refugees may face, right? And these risks are based on a mix of actual incidents and risks that LGBTQI organizations anticipate due to the experience, but may not observed as a fact. All right, next slide, please. So we identified a number of safeguarding risks that LGBTQI refugees faced when fleeing abroad, when fleeing the war and Russian aggression in Ukraine. So, and one of the biggest risks that we identified is discrimination and risk of outing by non-LGBTQI actors. Unfortunately, safety, security of sexual orientation and gender identity data of LGBTQI representatives is not taken seriously very often. And this is a huge risk. That's why LGBTQI people very often do not disclose their identity and prefer to stay unnoticed as the members of LGBTQI community. The next risk that we would like to talk about here is the risk associated with LGBTQI refugees being hosted in non-vetted hostels or families who do not accept LGBTQI persons. So this is a huge risk as well. So for LGBTQI people, it's very important to stay in a safe environment where their identities will be accepted, understood, and not discriminated against. And these risks, again, associated with being in the environment that would not be really accepting, is very big, and that's led to a number of incidents, and of course to some measures that LGBTQI organizations in the region would provide in order to offer LGBTQI refugees safer spaces. For trans people, we identified such a risk as lack of appropriate and safe accommodation in government-run facilities. And of course, for people who identify as trans, this is a very serious risk of harassment and violence in shared accommodation, because very often trans people are not accepted, and very often they are a victim of harassment and violence in this situation. And the next risk I would highlight here is risk of discrimination, harassment, and violence in LGBTQI spaces. That was a very interesting output of the research that we did with LGBTQI organizations in the region, right? Particularly if LGBTQI refugees share limited spaces that lacks privacy, we observe here risk of discrimination and harassment towards, let's say, trans people and people who identify as lesbians, right, queer people, right, from members of the community. Next slide, please. Right, and we would say that if we summarize those risks, right, so the lack of safe and inclusive services for LGBTQI refugees would lead to such consequences as harassment, discrimination, exploitation, and violence. And there are cases, right, that were documented by LGBTQI organizations in the region. Unfortunately, people are very hesitant to report these cases because of various reasons, and LGBTQI organizations are really struggling to document these risks. and these consequences in full scale. Next slide, please. So among the other risks that we identified here is being targeted for sexual exploitation when private persons who offer support and accommodations are not vetted. So this is a huge risk, and here we see a risk of sexual exploitation and gender-based violence as well. Then risks associated to referrals to external health services who may not hold discriminatory attitudes and cause harm, right? So, for example, if healthcare providers are not aware of the services that LGBTQI+ community may need and not aware of their attitude and not aware of the right approach to the community, it can lead to discrimination and harassment again. We identified data protection risks, so personal data held by organizations could be used to target and harm LGBTQI refugees, and this is a huge risk as well, as organizations often collect the private data as passport numbers, for example, right, or photographs, or passport legal names of trans people, right, and this could really lead to a serious harm when there is a risk of disclosing this data. So I invite you to read more about those risks in our report that, as Sarah mentioned, you can find on a website. And I would say that the huge work behind this report would support our recommendations that I will be presenting to you later, right? And these recommendations are really about how we can prevent those risks and how we can plan our interventions in a way that would really avoid harm for LGBTQI community members and help us to really safeguard refugees fleeing the war. Please, next slide. Right. So, and safeguarding practices that LGBTQ organizations adopted to avoid these risks, were they identified or not, right, is a very important part of the report as well. Right, and of course, first of all, providing safe and inclusive services for LGBTQI refugees was the practice number one that we identified in all countries, in Moldova, Romania, and Poland. Right, having policies and contracts with clear rules and expectations for those staying in the shelters in place. So this is a very good practice that was implemented by few organizations that we were working with while preparing the report, right? And assigning existing staff with experience of working with LGBTQI communities to work with refugees. Say only those people who are really prepared to work with LGBTQI people were actually working with this community group. Is another kind of protection practice that was implemented by LGBTQ organizations to avoid safeguarding risks. And next slide, please. Providing internal staff training, so for those people who were probably not prepared to work with LGBTQI community and refugees, right? Internal staff training would be in place. Right, having codes of conduct, ethical codes, and HR policies, right? For example, like reference checks, right? This was implemented as a security practice in by few organizations we worked with, and one organization reached out to LGBTQI organization that works with refugees in Greece to learn from their experience of running shelters. And this is a very interesting practice that would be leading to recommendations. Later, one of the recommendations that we will be talking of, right, because this experience exchange is very much needed in this situation. All right, next slide, please. All right, providing referrals only to trusted service providers would be a very useful practice here, right? So mostly all LGBTQ organizations have a list of trusted service providers with whom they are working, right? Mostly it's healthcare providers, and referring LGBTQI refugees only to this group of specialists would really help to avoid many risks, right? With the data breaches and leaks, right, minimizing the risks of this event, very simple. Just collect the minimum amount of data, right, and not storing a lot of data within the organizational cloud services or hardware. Supporting safer onward journeys through connecting LGBTQI refugees with trusted LGBTQ organizations was really one of the practices that were implemented in all 3 countries, which is a good sign as well. Next slide, please. And Sarah, I'm coming back to you.
Thanks so much, Lenny. And thank you for the people who have started to put some questions in the Q&A box. We will pose them to the participants of the roundtable, which we're just about to launch. So again, if our participants can put on their cameras now, we're going to hear from a number of really interesting, fantastic people, as well as Lenny. So I'd like to introduce the other 2 panelists today. The first panelist is Vlad Vishki. Vlad is a feminist LGBT activist and a PhD candidate in political science at the University of Bucharest, as well as the executive director for Mosaic Romania. He graduated from the Central European University with a master's in political science, focusing on the LGBT movement after 2001 in Romania. He holds a bachelor's in political science from California State University. He took courses at Tel Aviv University and Hong Kong University and has published numerous articles around the world. Between 2015 and 2018, he was the president of the Mosaic LGBT Association, and you can find out more about him on our website. Milos Przetporkowski is the deputy head of the board at Lambda Warsaw Association. He's the co-creator of the Help Center for LGBTQIA+ refugees and an advocate for people under the so-called Bi+ umbrella. He's the co-author of the first book in Central Eastern Europe, fully devoted to the Bi+ community. At Lambda Warsaw, he's also responsible for international projects, fundraising, and PR activities. And again, you can find more information about all 3 of our panelists. So thank you for joining us today, Lenny, Vlad, and Milos. So the first question that I have, I'd like to address to all of you. Since LGBTQI+ refugees are a diverse group, we know that people's different identities and circumstances shape their risk for being targeted for harm and abuse. In your context, how did you see this play out? Are there any groups of LGBTQI refugees who faced increased safeguarding risks or specific risks in your country? Maybe Vlad, you can start, and then we could hear from Lenny and from Milos.
Yes, thank you for having us. So since the start of the war, us on February 24th of last year, Mosaic was one of the numerous organizations in Romania, LGBT as well, LGBT organizations, supporting LGBT refugees fleeing the war in Ukraine. And to do so, we developed a shelter in order to host LGBT refugees. We offered various services, but we were extremely inexperienced in this field of work. In general, in Romania, Romania hasn't been confronted with such a wave of refugees in recent past. and it's not our field of work necessarily. So we had to develop everything. Only one day we started receiving calls. 6 people, 8 people, 4 people were coming per day. And we had to develop a system in which to manage all of this situation. And we partnered with various organizations in Romania, LGBT organizations in Romania, in order to increase their capacity to assist these refugees. And also we partnered with organizations in Hungary, but also in Moldova and in Ukraine, in order to coordinate each other better in this response. And I can give you an example. For example, someone is calling you and telling you that I will be arriving in the main railway station on Wednesday at 4 p.m. And then you're like, okay, so what am I supposed to do? This person is asking for help, and how do we assist them? How do we help them? So we developed a system from the second a person calls us, gives us a call, who takes up the call, what are the main questions that you're asking, what's the trajectory of that person, who goes to the train station and picks up that person, where do you host that person, how do you contact potential partners in other countries where that person is trying to reach. So from A to Z, we had to evaluate, create a vetting system, and so on. But I think I'll speak a little bit more about this also as the webinar goes. Some of the challenges that we've seen in terms of safeguarding have to do, for example, with people's different identities indeed. We have had cases of trans people being put in shelters that were gendered, and they did not, they weren't the gender that they identified with. And this creates, of course, a situation which needs to be mitigated. First, we booked rooms on Booking or all sorts of websites, Airbnbs and so on, but that was not necessarily viable. So we had to rent some apartments and host people over there. So in terms of shelters for trans people and their safety in these shelters, state-run shelters, also for the other letters of LGBT, either lesbian, gay, or bisexual. We also had a lot of lesbian women come to us, and also they were coming with their families, so their sisters, their mothers. So we had to make a decision also. Are we hosting the whole family? Something that we did, but how do we manage the situation? And then, of course, they would come also with animals, and we had to find places that would host animals as well. And at one point, Hungary, I believe, forbid the animals from crossing into Hungary. So all of the refugees that would go towards Hungary would have to abandon their animals, something that's cruel, of course. After that, there's the people living with HIV. How do they access services in terms of treatment in Romanian healthcare system? First of all, the Romanian healthcare system subsidizes treatment for people living with HIV. However, due to corruption or due to bureaucracy, the treatment is not procured. So procurement policies are not done in time to cover treatment for everyone that needs it. So in the absence at that time, now we have the temporary protection directive and the temporary protection assistance. The question was, how do we assist these people? And here we do have colleagues that work both in going to the hospital with the person to integrate them and into the system, but also to accommodate this lack of treatment at one point. So the problem was here that the rights of people living with HIV, even Romanian, were in breach. So we had to adapt to this. After that, the issue of crossing the border, a lot of people are desperate and a lot of people are trying to cross the border, especially people that have a gender marker in their ID as male because of the draft in Ukraine. Our services never covered crossing the border. I know that there might be entities or organizations that do try to organize these crossings, but we never did. The services that are done and that we offered were specifically for the people that were on the territory of Romania. However, we did identify different solutions. For example, at the border between Ukraine and Moldova, there's stations where both guards from Moldova and Ukraine are sitting at the same place. So the Moldovan partners would advise refugees to go directly to the Moldovan officers and ask for asylum immediately, and they would be protected. But this crossing the border can be a very risky situation, so we never advised people to cross the border illegally. After that, the fact that gay couples are not recognized under Romanian legislation created some problems, especially for couples that were mixed, in which one was Ukrainian, another one was Russian, and then the Ukrainian would get the temporary protection under the legislation, but then the Russian would have to be deported. So this can create a breach in a family, basically. After that, violence in Romania against LGBT people. And here, unfortunately, I'm going to salute Milos and I'm going to tell him that there's a battle on the ILGA Europe map between Romania and Poland, who's worst in the European Union. This year, I think Poland is a little bit under Romania, but in general, rights of LGBT people in these two countries, and especially in Romania, are always breached. So violence against LGBT people is quite common in Romania, people being beaten on the street because of their gender expression or because of their sexual orientation or gender identity. So, and Romania does not collect data on hate crime and hate speech. And this, of course, means for many LGBT refugees from Ukraine that they need to be safe on the street, but at the same time be warned about the realities within this country. And of course, discrimination that can come from social workers, from border patrol, from all sorts of entities that are state-run entities that also we need to pay close attention. And of course, as you mentioned, and I'll just finish now, data breaches in terms of personal information about your sexual orientation, your gender identity, and so on, which we need to pay really close attention to as well. So this is just a short overview of some of the challenges.
Yeah, and I definitely want to recommend that everyone read the report because we've gone in more in-depth detail there. Milos, Vlad called you out. Do you want to add anything to that?
Yes, thank you, Vlad, for talking about the situation in your country. And yes, we are battling every year between Romania and Poland. Poland is proud, and here is a big quotation mark, to be for the 4th time in a row the country in the European Union with the worst legal situation, according to ILGA Europe's Rainbow Map. And this is a horrible situation also for refugees. When we mention risks, I'm especially thinking about transgender and non-binary refugees, which are the most targeted when it comes to hate crime, sexual abuse, gender-based violence. And this situation actually is getting worse due to the propaganda of our government, which is this year has decided to use transgender and non-binary persons as the scapegoat for this year's election, which also obviously targets refugees who became a part of our civic society. And we are facing basically everyday problems when it comes to the access of hormones, to the access of qualified doctors. This is something that we have been facing from the very beginning. I also wanted to add to the risks, also similar as in Romania, men, gay, bisexual men with HIV positive status, who, yes, they have access to medication, but sometimes they didn't know where to find it, so they were contacting us. And also one risk that I want to mention was in the beginning of the war, we received many emails, sometimes even on Lambda Warsaw's Messenger, from Western countries, usually mostly from gay men, that they would love to accommodate and help a young gay man, which for us was obvious that we cannot send this person somewhere abroad, not knowing where. So what we started doing from the very beginning, we got in touch, and Lambda Warsaw is the oldest LGBTQIA+ organization in Poland. So we have many contacts in Germany, in the Netherlands, in the UK, with other organizations, of course, also with Ukraine. So what we did first is we contacted Ukrainian organizations to inform people on their social media that whenever they cross the Polish border, they can come to Lambda Warsaw and they will find complex help here. This is how people found out about us. When people wanted to relocate to Western countries, we didn't buy them a ticket, to go nowhere. But of course, we were buying tickets, but tickets to always staying in touch with international organizations. So we wouldn't send people, to private persons who offered their help, because we don't know if this was real help or it was sexual exploitation. And this was for us a very, very important issue, to avoid sexual exploitation and limit gender-based violence or violence based on the sexual romantic orientation. When one of our mechanisms in the very beginning, when we still didn't have our 2 shelter flats as we do now, we were communicating to our LGBTQIA followers on Facebook, asking if they have to offer a safe place. And especially with transgender and non-binary persons, we also had Julia from Transfuzja, which is a trans organization in Poland. She was offering free trainings to people who would host trans and non-binary refugees. So we were really aware of the fact that this group needs special help and a special approach, and this is what we were doing from the very beginning.
Thank you so much, Miloš. That's super interesting. I'm going to now move to my next question about any good practices that you saw. You've mentioned a lot of the many challenges that people faced and that you all faced in responding to really unprecedented refugee movement in Eastern Europe. So what about are some good practices in safeguarding that you saw in your contacts? And, if your organization's implementing them, please feel free to talk a bit more about that. Vlad, and then Miloš, then Lenny.
Yes, so basically we ran 2 shelters with support from Oxfam. And of course, we had to think about the vetting procedures first, the interviews that the person that would enter the shelter would go through with our social worker in order to evaluate what their plans would be, if they plan on staying in Romania or they want to leave for another country, if they have Ukrainian citizenship, if they don't have Ukrainian citizenship, if they want to go back to Ukraine and so on. So this whole vetting procedure in terms of their needs also, what would be their needs in terms of, I don't know, healthcare or other elements as such. Of course, anyone who would enter the shelter would sign a contract. We had to draft contracts both in Russian and in Ukrainian, with the specific rules regarding noise, regarding respecting the neighbors, respecting the others living in the shelter, because you can imagine that when you have multiple people living in a specific space, people that have never met or are come from different walks of life, there would be some sort of conflicts. And then there would be rules such as the social worker visiting the shelter every other day, and they would need to communicate with the social worker. Of course, sometimes communication was difficult because people would not speak English nor Romanian. Finding translators would be either expensive or quite difficult because Romanian language is a bit different from Ukrainian language. Developing an exit strategy just in case there needs to be an exit as well. And this needs, of course, planning. And another element which we noticed was that once we advertised the services that we were offering for Ukrainian LGBT refugees, was that local Romanian LGBT people in need would want to access those services. So the question is, how do you balance this between people living in Romania of Romanian citizenship and Ukrainians? And we did have at one point both cases in which in the shelter would live also Romanian and Ukrainian. So we have had to manage this. Of course, with support from Oxfam, we also developed a safeguarding policy. We passed also an ethics code, and all of these elements are important to be communicated to everyone, including the, yes. So I see there is a question in Romanian regarding if LGBT people have to announce the manager when they are placed in a center. I'm not sure if it refers to the state-run shelters. I'm assuming that over there you need to notify when you're leaving the shelter or something. I can't say I really understood this question, but most of the LGBT Ukrainian refugees that would come to our shelter would not come necessarily from the state-run shelter. They would access directly our services via social media or emails or phone calls and so on.
I just want to point out, we only have 15 minutes left in our webinar. So Milos, would you like to add anything, or Lenny, about some good practices that you saw?
I would like to add very quickly to Vlad, because it seems like we are working in the same organization, because I have almost nothing to add. Similar here in Poland, in 2015, we started running a shelter for LGBTQIA+ persons in the homeless crisis. So that was our experience, although we didn't want to mix this shelter, which has very specific needs, with the Ukrainian shelters. This is also, and Vlad, the same situation, believe it or not, Oxfam. We also received trainings from them, also from HIAS, IOM, UNHCR, Mercy Corps, and also funds from different rainbow organizations such as All Out, Outright, and ILGA Europe. So this is what I wanted to add from the Polish perspective. But all the other situations, including the contract and the code of conduct, is basically the same.
These things written down and to communicate them regularly. Lenny,
And
did you
it's very
want to add?
important that the information is out there, you know, in the shelters, that people see this information and that they know how to react, how to behave, whom to contact.
Yeah, Great. Lenny, did you want to add anything about good practices that you saw or learned of when you were doing the research?
So I would add, like, Vlad and Milos touched on many good practices that implemented by LGBTQ organizations, but I would add that the safeguarding risks for Ukrainian LGBTQI refugees that we observe right now, they are actually discovering the whole bunch of issues within legal systems of countries in Eastern Europe, right? Say, for example, legal gender recognition for trans people or trans refugees, right? Is legal gender recognition available for trans people, trans refugees coming into the country, right? Say this question, for example, would be very important to look at when we talk of good practices, right? How we can advocate for this process in local contexts or on a national level. How we can advocate for accepting refugees who they are, right? And how we, for example, will advocate for access to trans-specific health services, right? Or LGBTQI specific health services for refugees if they are not included into healthcare system in the country. So there are many good practices that we can really take out of the report. When we come to the recommendation session, I will talk more about it.
Okay. So I'm going to skip my third question and move into the last question. And I want to tell the people that have been writing questions in the Q&A. Lenny has been responding to some of them, but we will write back to you and create a little document that we'll send to everyone afterwards, answering some of those questions. And I also wanted to point out that we will be having a roundtable in Poland on this report and recommendations for that. So our Polish colleagues who've asked a few questions, please get in touch with Karolina, our country manager, and we will be able to invite you to that. So my question to the three of you is looking now at the broader humanitarian response. You've mentioned a lot of great organizations that supported you, but what do you think are the humanitarian sector itself, not those that work specifically on LGBTQ issues, but the general humanitarian response? What can they do to better safeguard LGBTQI people? And maybe I'll let Milos start and then go to Lenny and Vlad.
I will keep it short because we don't have much time. I would say that they can learn a lot. And they also, when I was noticing working with different organizations, for example, the gender marker, we were very often asked, how many men, how many women do you have? And I'm saying, well, this is not the most important. This is not the crucial issue here because we have so many non-binary persons. How am I supposed to mark them based on how I see them or what is in their documents? And this is something that we don't do. Like the gender marker in the documents doesn't matter to us at all. It does, though, to many organizations, also international, which was a surprise. So here, this is one thing that they can learn, and also learn that it's not only gender-based violence, but also violence and abuse based on the sexual romantic orientation. This is something that is very crucial and still lacking for many international organizations. So this is from my side.
Thank you, Milos. Lenny?
Right, so I will be talking about this, but like the rule number one is to plan an intervention or plan a humanitarian response together with local LGBTQI organizations. That would be recommendation number one, and their experience with the community and the ability to reach out to the community is priceless in this case. Say, listen to them and plan all your response work together with local LGBTQ organizations would be very helpful.
Yeah, great. Vlad?
Yeah, shout out from Romania also for All Out, ILGA Europe, SPI, Choose Love, and Outright International, who also supported our work. Of course, in terms of recommendations for big humanitarian organizations, is training their employees, of course, on issues related to sexual orientation and gender identity. After that, I remember a working group with the UNHCR and the government in which we mentioned the issue of transgender people accessing healthcare, and the Ministry of Health of Romania was like, oh, we know about the issue, everything is undercover, everything is fine, it's perfect, it's working. And for us, it was like, okay, we know the situation in Romania. So when it comes to lobbying activities, advocacy efforts, in all this dialogue of coordination with UNHCR and with other entities, always put on the table the issue of LGBT rights as well, and of the situation of LGBT people. And last but not least, I do believe that there needs to be a shift in the way funding goes in terms of funding. Offering core support for LGBT organizations, especially in this area where we're talking about organizations with little support that are being told to access funding for a very short time period, 3 months to 6 months. There's a big strain on the workers working in these organizations. There's no mental health for them, and so on. So for the employees of these organizations. So, and oftentimes once the funder, the humanitarian organization leaves, it leaves behind an organization that it's tired, its resources in terms of human resources are depleted and so on. So it's very important to pay attention to core funding as well.
Yeah, and that gives me a little slot to promote that on the Safeguarding Hub Eastern Europe. In the next 2 months, we will be highlighting mental health and emotional support for CSOs as a necessary condition for safeguarding. So we hear you loud and clear. You know, it's the small CSOs that you all represent that have been doing like a lion's share of the work supporting really vulnerable people. So thank you for that. So as we move to the end of this webinar, I'm regretting that we only scheduled it for an hour because there's so much interesting things that you all have to say. I'm going to ask Lenny if you could present some of the recommendations. We've touched on a few of them. And then Vlad and Milos, just to add any last words that you have. And I would encourage everyone to please stay on the webinar for our poll that we will launch after we hear from Lenny. Lenny, please.
Right, very briefly. So our recommendations include, of course, the thing that I just mentioned, this partner with local LGBT plus, LQ plus organizations, right? So this is approach number one that is recommended to adopt for every humanitarian response intervention in any country. Tailor the safeguarding support to the needs and capacity of LGBTQI organizations. That would be very important, especially in the needs section, right? So LGBTQI plus organizations really have this knowledge, what is really needed. Support learning exchange on LGBTQI inclusive safeguarding. So this is a very important thing, experience exchange, knowledge exchange. So this is what needs to be supported. Advanced LGBTQI inclusive safeguarding in the humanitarian sector as a whole. So that must be really a separate approach on inclusiveness on advancing the LGBTQI plus inclusive safeguarding, and that must be implemented as a whole system approach, not the steps that we would implement here and there. Next slide, please. All right, so Sarah.
Vlad and Milos, any last words, any calls to action, anything you would like to say directly before we go to the poll?
Yeah, I would just thank you for inviting me. Thank you for all the efforts. I do believe there is a need to strengthen regional cooperation. There is a lot of regional cooperation, and this was a way in which all of these networks that we already had, also under the ILGA umbrella, but we need to strengthen this and maybe coordinate better when discussing with actors that are large humanitarian organizations coming out to roll out their plan in the region, and not forgetting about local beneficiaries and people that need help in these countries in connection with the LGBT rights that are under pressure in Eastern Europe.
Great, thank you. Milos?
I also wanted to thank those who was working with us together on this report, especially to Lenny, who was a wonderful coordinating person. I just wanted to add one thing that, in my opinion, organizations affiliated to the UN should put more stress on the Polish government and generally on governments in different countries, that LGBTQIA persons are a vulnerable group of refugees, because this is something that Poland doesn't recognize. Quoting, we help everyone equally. We don't look what people are doing in their private lives. So there is a total lack of understanding of the LGBTQIA plus groups, refugee groups in Poland, and something should be done with that. Thank you.
Thank you so much for that. Lenny, I'm going to give you one last word if there's anything you want to say as the author of this report and the person who guided us through this process.
Thank you very much, Sarah. So I would highly recommend everyone on this call to read the report and to spread it among your colleagues and partner organizations, right? So because this report, we hope it will now be very much needed for everyone who is working with refugees, with LGBTQI refugees and groups of refugees that might be very vulnerable in this specific context.
Thank you so much, Lenny. And I want to do a special thank you to Betty and Aniko on our RSH side for making this webinar possible. They're our fabulous technical and comms people. I'd also like to thank our country managers in Poland, Romania, and Moldova. Please reach out to them if you have questions or if you'd like to have more information on this topic in your country. And of course, always a special thank you to our interpreters, who without them, we would not be able to be heard across the different countries and the borders. Thank you so much for putting up with my fast English and anxiety as we end this webinar at the end. Please go to our website and download our report, find out more information about the speakers today. Thank you, Vlad, Lenny, and Milos. Thank you very much.